evidence-based practice. And the point is regularly.
Breach is a nice term.
Breaches in evidence-based practice. And a big part of this particular course is every week we have an evidence-based practice concept. And so you will be responsible, and we're going to get into that discussion, each of you. Again, it's no homework, it's a matter of we do it, that's what you're going to do that clinical day, is you're going to look at the evidence, you're going to see if it's being embraced by the facility where you're working, and you're going to make notes about what was done well and what was not done well, not to them. This is what we discussed in post-conference. It's not our responsibility to jar up the whole hospital. But you're going to see lots of things, and then we're hoping the whole concept is you're not going to accept that when you become nurses. It's not acceptable. There's lots of things that happen that's not acceptable. So you have to stand up, because that is the patient advocacy role. And nurses really are. I mean, with all the new things that are coming out with institutions of medicine, they're saying nursing is in the role of picking up the slack in healthcare. And we can either belly up and do it, or we can just let it go and let the patient. And I don't know about you, but I had to stay even on top of my patient care when I was in the hospital recently. And when I woke up from anesthesia, we had a little discussion because they had some drugs on me that they shouldn't have had on me because they didn't fill my tank appropriately. And I told them before I went under anesthesia to make sure they gave me plenty of fluids, and they didn't do it.
And I got to spend an evening in my own ER after spending a couple weeks, like, if you will just do this, if it works, that's what it is. And anyone remember extrapyramidal signs and symptoms from mental health?
She had them.
Big time. Big time. It was bad.
It was hard to determine if it was really her or the medicines.
True.
But
True. Angelica,
Don't make me
remember,
aspirate.
I've got some stories on you too, darling. She was in our youth group at
I
church,
bet she
so
does.
I've definitely got stories on her.
So is everybody okay with what that handbook says and what your obligations are to the handbook?
One
Because
of my favorite sayings is the doctor might be the head, but the nurse is the neck, and your head does not work without your neck. And so we are the
totally different direction with that.
sorry about that. But
me too, I was on something all different.
sorry.
ER humor there kicking
Yeah,
in.
advocacy.
She's the
patient
OR, they're all
advocacy,
non-responsive.
And we are responsible for the doctors. You know, they would never know anything unless it comes from us. And that's a point for patient advocacy, my point.
The other thing I want to reinforce over and over and over again is, the other thing is that it doesn't matter also what your degree is when you get out of school. You still have the same obligation to the patient. So whatever stuff you hear, doesn't matter. You are equally at the level of managing patients. And I have worked for years in hospital-based education, taking the new grad and making them a critical care nurse. And my point was, I really didn't even want to know what their background education was, because they all had the same end result requirement. You have to be able to take care of the patient. And I kind of liked the associate once I found out, because they stayed 3 or 4 years and the BSN stayed a year. So it's kind of nice to have someone there with continuity that can kind of move things, and you do improve when you have continuity. So again, any questions about the handbook and what your obligations are with the handbook? And again, if you pulled up the schedule, you know exactly, you know, we get a week off for spring break. I always like to mention March 18th, which is the final day for withdrawal with the W. And I'm not saying that because I believe any of your, but I don't ever take for chance that you can improve a grade at the end. So you need to come and counsel with somebody if you are below a passing score, and it won't be your clinical instructor typically, because that's not where you're not passing typically. So you need to make sure you're making appointments with either Miss Schinhelm, Miss Moore, or Ms. Dewart.
And my appointments are already in TopNet. You look at your schedule, you see when tests are. If you think you're gonna meet with me, go on and sign up for an appointment is basically my recommendation. Don't wait until the second test. We will tell you, we encourage you, review every test. If you missed 2 questions, if you missed 1 question, meet with us
Find out why.
and review. Because that one question, the thought process that you used on that one question, we're gonna look at that, and that's gonna be your chance. You know how if I came in here and introduced myself as Miss Smith, if you saw me out in the hall, or you understood that my name was Miss Smith, what are you gonna call me? Miss Smith.
Well, there's other names I'd probably.
Well, this is true. I've called a few of those. But the thing is that what are you going to call me a year from now? The first thing that's going to pop in your head. It's not Stewart, it's Smith or something else. But, especially after a year with me. And, but the thing is that sometimes you get a line on vision on something that you've understood it this way. And it's totally wrong, and it messes up a series of things. So that's why we say, come review with us. Talk to us. Say, I don't get that, because every one of you learn differently, and let us switch it around some. If, you may come to me and the way I explain it, it's like, well, still, it's fun to ask someone else. I'm still having trouble grasping it. Don't just say, okay, and go on. That doesn't help you any, okay? That doesn't help you any. So,
Because we still got
bond with your
acid-based and
instructors.
fluid electrolytes this semester.
mm-hmm.